I'm really excited to talk to you today about a new and innovative office-based therapy for the treatment of stress urinary incontinence. Stress incontinence affects 5 to 35% of the U.S. population and affects women of all ages. Unfortunately, the condition worsens over time and can have a significant impact on activities of daily living. Traditional treatment options have included pelvic floor exercises, physical therapy, or surgery. The ideal treatment would be safe, effective, and avoid surgery and synthetic implants. And office-based therapies are attractive for patients and physicians alike, secondary to the convenience and the safety. And most importantly, it's COVID-friendly. Periurethral bulking agents have been around since the early 1900s, so the technique and the technology is not new. Essentially, a material is injected through the cystoscope to help close the urethral sphincter and maintain continence. In the past, a variety of injectables have been used, starting with wax and then progressing to collagen, carbon pellets, coaptite, macroplastique, and even silicone. Past injectables have had a low cure rate, a high rate of repeat injections, and significant complication rates. Bulkamid is the most recent injectable offered for periurethral injections, and it's essentially a game changer. It's a revolutionary new material and injection system composed 97.5% of water and 2.5% of a biologic resin. It creates a soft, homogeneous gel to close the internal urethral sphincter. Over 70,000 patients have been treated in Europe in the last 10 years and have shown a 75% success rate with no long-term complications. The injection system consists of a small telescope inserted into the urethra through a disposable guide which helps to ensure injection at the proper location. The procedure is done under direct visual and video confirmation. Under direct visualization, a small tiny needle is advanced into the urethra just before the bladder neck where the Bulkamid is to be injected. Slow injection of the Bulkamid results in bulking of the urethra, described as a cushion. The first injection is performed at the 6 o'clock position, and then subsequent injections are performed at 3 and 9 o'clock as needed to close the neck of the bladder. The entire procedure takes approximately 5 to 7 minutes to perform in the office. Patients experience little discomfort during the injection, and the surgeon can assess response in real time. Most remarkably, after the injection, a cough stress test is performed to ensure correction of leakage, and more material can be injected as needed. Bulkamid offers the patient and physician many benefits. It's a short office-based procedure which can be performed under local anesthesia. Studies have shown it to be safe, effective, and durable. There's no need for hospital visit or anesthesia. There's no postoperative restrictions, and patients can get additional injections in the future as needed if they have recurrence of their incontinence. Most importantly, it does not preclude the patient from other treatment options, including physical therapy or even surgery. So who is a candidate for Bulkamid? Any woman with bothersome stress incontinence, regardless of age or body habitus. It's ideal for elderly patients who want an effective and safe treatment option without anesthesia. It's great for women who want a safe and effective office-based procedure, or those who want to avoid major surgery, hospital visits, anesthesia, or postoperative recovery. It's ideal for women who want to avoid mesh use, and we've also used it on those women who have persistent stress incontinence after incontinence surgery or recurrent stress incontinence after a sling removal. In addition, it's a great option for those women who have not completed childbearing and would not like to pursue a more invasive surgical option. I'd like to share with you a patient testimonial from a patient who recently underwent the Bulkamid procedure.
I initially visited Dr. Coley of Boston Urogyn in June 2020 to seek treatment for urinary incontinence. Dr. Coley performed a mesh sling surgery, which unfortunately was not successful given how I presented as a severe case. I was very concerned about the continual urine leakage, and he suggested a new procedure, Bulkamid urethral injections. He performed these injections in his office. The procedure lasted approximately 30 minutes and was relatively pain-free with local anesthetic. I was overjoyed with the results since the leakage stopped immediately. I experienced no pain or symptoms afterward and was able to resume my activities that day. This new procedure offers a solution for many women, which wasn't available until recently and can be done without surgery as a doctor visit.
To conclude, Bulkamid represents a revolutionary new treatment option for women suffering from bothersome stress incontinence. It's an office-based treatment which is safe and effective. European studies have shown good long-term results with 7-year safety and efficacy data, and it really represents a new option for a variety of patients who may otherwise go untreated and continue to suffer from stress incontinence. More information is available at our practice and available at bulkamed.com.